40.1. Complete table with words from C opposite. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. A noun, an adjective. Noun. Excitation, excitation, fatigue, lethargy, tiredness, exhausted, fatigued, lethargic, and tired. 40.2. Make word combination using a word from each box. Look at A, B, and C opposite to help you. Complain of color, of sorts, and worn out. 40.3. Complete the sentence with the correct form of the verb present. 1. A 67 years old man present with a 9-month history of increasing shortness of breath. 2. The most common presentation is loss of consciousness. 3. Cranial arteries may present as fever without any obvious causes. 4. The patient usually presents with a severe sore throat. 5. The presenting symptoms in these patients could perhaps be due to renal failure. Renal failure. C. Other conditions with a similar presentation include acute cholecystitis. 7. Reduced growth is an important presenting complaint of uh, celiac disease. 8. 2 months following presentation, the patient was able to walk. 40.4. Read the patient's description of her symptoms, then complete the case report. Look at C opposite to help you. I was well until a few months ago. In the beginning, I just felt off color and a bit tired, but lately I've been feeling completely worn out at the end of the day. I'm not eating any more than usual, but I've been put on 9 kilos in the last year. My emotions are hard and my hair has started to fall out. Case 30. A 50 years old housewife who had been well until 4 months previously. 1. Complained of tiredness and mm, malaise. He had gained 9 kilos in weight in the year before she presented to her GP, although she denied eating more than usual. She was constipated and she noticed that her hair had started to fall out. And next to unit 15, 15. Find words in the box with opposite meanings. Look at B and C opposite to help you. Adequate, inadequate, against, to, against, for, unlikely, likely, severe, meal, rare, common, sudden, insidious. 14, 15. 15.2. Make word combination using a word from each box. Look at B and C opposite to help you. Bone, bone marrow, differential diagnosis, insidious onset, iron deficiency, pernicious ano, anemia, and vibration sense. Uh, Point three, complete the sentence, look at A, B, and C opposite to help you. 39 years old man present with a history of progressive abdominal distension over a period of 6 months. Two, blindness may be caused by vitamin A deficiency. Three, the bleeding and purpura are caused by a normal platelet function. The white cell count is normal, so we can exclude acute leukemia. The yellow color of her skin and conjunctive is probably due to jaundice. There was a palpable mass in the right upper quadrant of the abdomen. Treatment is aimed at restoring fluid balance with adequate intravenous fluids, and the anemia may be due to increased red cell breakdown. Point four, complete the conversation. Look at C opposite to help you. Professor, what is against this diagnosis of pernicious anemia of physical examination? A student. The problem started quite subtly, so it didn't have the typical insidious onset. And he doesn't have any um, skin femur, and he doesn't have symmetrical paresthesia or abstent vibration sense, and and it couldn't feel his spleen. Professor, what about his tongue? Studying his tongue was normal and not inflamed or sore. 16.1. Label the diagram using words from the box. Look at A opposite to help you. One skull, two jawbone, four breastbone, five rib, six collarbone, seven shoulder blade, three spine, eight thigh bone, nine kneecap, 10 shin bone, 16 2.2. Match the type of fracture with the description. Look at B opposite to help you. One, open, A, there is a break in the skin. Two, community, two, to see the bone is broken into several pieces. Three, displaced. Displaced. To D, the broken pieces are separate. And four, green stick. To B, the bone is bent. It occurs mainly in children. Five, impact. To E, the broken pieces are pushed together. 16.3, complete the textbook extract. Look at C opposite to help you. One, reducing fracture involves trying to return the bones to as near to their original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will width, but it may go on to malonium. Uh, 17.1. Complete the table with words from A and C opposite, then complete the sentence with words from the table. Verb, delay, no, delay, delayed, delight, delayed, develop, development, develop, distant, distension, distented, fail, failure, failing, nourish, nutrition, nutristed. When babies with the fetal alcohol syndrome may present with failure to thrive, abdominal distension may be due to a larger liver. Three, small amounts of alcohol in pregnancy can affect fetal development. Mortality from measles can be reduced by better nutrition. Delay in one or more of the milestones may be the first sign of disease. 17.2. Complete the sentence. Look at A and C opposite to help you. One, after sitting, babies learn to crawl and then to walk. Two, a child who has started eating solid food has been waning. Three, someone who is not very tall is said to be of short stature. Four, the stage in a child development are known as the milestones. Five, a child who is beginning to develop sexually has reached puberty. 17.3. You write the common English name for each disease using your medical knowledge. One, a large parotid gland, mumps. Two, difficulty opening the mouth, lockjaw. Rash and large posterior occipital knots, German measles. Four, paroxysmal cough with vomiting, um, whooping cough, uh, papules and vesicles, first on trunk, chickenpox. Cough and cold followed by rash, uh, measles, sore throat and rash, scarlet fever, swollen joints, and a hard murmur, rheumatic fever. Fever followed by muscle weakness, polio. Cough with stridor, crop. Eight- 18.1. Complete the table with words from A, B, and C opposite and related forms. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. Verb and noun. Inhibit, initium, produce, production, release, replace, replacement, secrete, secretion, simulate, simulation. 18.2. Complete the passage from a textbook using the illustration and your own knowledge. Look at the opposite to help. Pulse of GnRH, gonadotropin-releasing hormone, are released from the hypothalamus and stimulate LH and FSH, released from the pituitary. LH simulate testosterone production from Leydig cells of the testis. Testosterone feeds back on the hypothalamus pituitary to inhibit GnRH secretion. FSH stimulate the Sertoli cells in the seminiferous tubules to produce mature sperm, and they inhibits A and B inhibiting cause feedback on the pituitary to decrease FSH secretion. 18.3. Complete the sentence. Look at A and C opposite to help you. Diffuse change affects many parts of an organ or gland. A localized change affects only one part. His diet is deficient in iron. He doesn't get enough iron. Excess T3 and T4 increase the basal metabolic rate. 18.4. Match Mr. Davis' symptoms with the question her doctor asked. Look at the opposite to help you. 1. Diarrhea. Are you bowels normal? Eating more? What's your appetite like? Heat intolerance. Do you prefer hot water or cold? Overactivity. Are you able to sit and relax? Palpitations. Have you ever felt your heart beating rapidly or irregularly? Weighting loss. Is your weight steady? Tremor. Do your hands shake? 19.1. Complete the table with words from be opposite and relate forms. Verb non and active. Accommodate, accommodating, constrict, constriction, constricted, converse, convergency, delayed, dilatation, dilated, drooping, oscillate, oscillation, reaction. A. Drooping of lids, seeds. Delayed pupils. 3. Irregular pupil. 2. Cataract. 5. Skynt. 1. Constricted pupils. 4. 19.3. Complete the strat form a textbook. Look at the opposite to help you. Retinoscopy. Examining the retina with a ophthalmoscope, if possible, with the pupil delayed to obtain the maximum view. Look for pa pa- papilledema and for flame shaped hemorrhages and cotton wool exorcist. Assess the state of and know the 20.1. Complete the case report. Look at A opposite to help. Case 40. A physical examination revealed a teen girl with a slight pallor. She was not obviously dehydrated. The temperature was 38 grades. Pulse 100 minutes. Blood pressure 110 to 80. Examination of the rest of the cardiovascular and respiratory systems was normal. The abdomen was not distended. There was generalized tenderness, which was most marked in the right lower quadrant, and was associated with warning but not rigidity. There was no rebound tenderness and no more mosques were felt, vowel sounds were reduced. 20.2. Match the description of the stools 1 to 6 with the condition most likely to cause them using your medical knowledge. Look at the opposite to help you. Type of stools, loose bloody, ulcerative colitis, loose pale bulky, coliac disease, clay colored, obstructed jaundice, a black tarry, a gastric ulcer, a small heart, irritable bowel syndrome, clear watery with mucus, cholera. 20.3 match the features to the doctor's question. Look at the opposite to help you. Blood. Have you passed black stools? Bowel avid. How often do you open your bowels? Change in bowel habit. Are you going to the toilet more often than normal? Bulk, is the size of or the amount of the stool normal? Color, what's about the appearance of the stools? Consistency, are the emotions hard or loose? And offensiveness, do the emotions have unusual smell? Unit 21, 21.1. Read a simple English phrase for each of the medical terms below using your medical knowledge. Look at A and B opposite to help you. Hysterectomy is the surgical removal of the uterus. Menorrhagia, prolonged menstrual period. Salpingitis, um, um, uh, Fallopian tube infection, or cervical biopsy, biopsy of the neck of the womb. 21.2. Read the conversation between the giant, gynecologist and the patients in C opposite and complete the notes about the patient. Menarche, 12 years, a menstrual cycle, 4 or 5 days. LMP, a week ago. Menorrhagia, not really. Dysmenorrhea, no. Discharge, a white discharge. 21.3. Now, write the question that the doctor asked. Look at the opposite to help you. Menarche, how old were you when you started to get them? Menstrual cycle, are your periods regular? LMP, when was your last period? Menorrhagia, will you say they are light or heavy? Dysmenorrhea, do you get period pain, discharge? Is there any discharge between the periods? 21.4. Complete the case report. One word is needed twice. Look at B and see opposite to help you. Case 15. A 45 years old woman had been having prolonged periods lasting for 8 days with the passage of blood. blood For 9 months, there was no bleeding between periods of or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously when a Cooper cup was fitted. She had a normal pregnancy when she was 20. 22.1. Complete the conversation based on the case history in B of doctor. What seems to be the problem? Patient. I've been getting palpitation. Doctor, how long have you had them? Patient. For about 6 months, but I've had heart problems for years with tiredness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I have to sleep on 3 pillows. I have mitral valve replacement 3 years ago, and that improved things for a while. 22.2. Make word combination using a word from each box. Two words can be used twice. Look at B and C opposite to help you. At rest, trial fibrillation, cardiac output, cardiac failure, heart failure, uniform beating, edema, premature beats. 22.3. Write the words a patient will use to describe the symptoms below. Look at A, B, and C opposite to help you. Dysphonia, shortness of breath, arrhythmia, palpitation, orthophonia, breathless when time plot, or odeemia, swelling. 22.4. Complete the case report. Look at A, B, and C opposite to help you. Case 13. A 60 years old woman attended her GP's surgery complaining of breathlessness on exertion. This had been increasing over the previous 8 months until it was producing problems. Arrow um, 500 meters, 5,000 meters Mary's walking on the level. There was no history of chest pain and were associated with some shortness of breath. She had noticed some swelling of her ankles by the end of the day. They disappear over. This disappear over. 23. 23.1. Complete the table with words from a opposite. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. But as auscul take, auscultation, examination, inspect, inspection, palpation, percussion. 23.2. Put the steps for examining the heart and circulation in order. According to the four-stage system, look at a opposite to help you. Measure the heart size percussion. Are there any murmurs? Osculation. Feel the radial pulse palpitation. Look for clubbing inspection. Locate the apex beat palpation. Note any trills palpate. 23.3. A doctor is presenting the case of a 43 years old woman at a meeting in the cardiology department. Complete the text of her presentation. Look at the opposite to help you. On examination, she was pyrexia with a temperature of 38.5. She was she was short of breath. Her pulse was variable between 1,000 at 1,080 and was irregular in time and force. Her blood pressure was 1,030 and 80, and her GBP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulse were all present and there was no central or central cyanosis. Her apex beat was displaced to the anterior axillary line, but still in the fifth intercostal space. Her heart sounds were very interesting. When she was initially examined, it was noted that she had pansystolic and mid-diastolic movements. Heard best at the apex. When she was examined, somehow hours later, there was a harsh pericardial friction rub all over the pericardium. Our diagnosis at that time was of mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation. 24.1. Match the two parts of the sentence. Look at B and C opposite to help you. A1. Mm, eh, 1288 saw the UK launch of Live Attenuate, measles, mumps, and rubella, MMR vaccine. Chickenpox, varicella is a common infection, disease of childhood. Rabies has an incubation period ranging from 4 days to many months. The patient remained febrile uh, with peaks of temperature of 39.5 grades. Uh, he was admitted with a 4-day history of influenza-type symptoms of fever with rigors, myalgia, and general malaise. Quite a proportion of patients who recover from hepatitis B become carriers of the virus. The central part of Africa is in the midst of an epidemic of AIDS. Measles rubella is most infectious during the catarrhal state. Lyme disease is caused by transmission of B. Burgdorferi from animal to man by exotic ticks. PUOO stands for uh, pyrexia of unknown origin. 24.2. Complete the case report of the patient in A opposite look at A, B, and C opposite to help. Case 45. On examination, he looked unwell. His pulse rate was 1,000 minutes. He had a palpable spleen, the combination of fever and rigors, rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 40 days, 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. 24.3. Complete the sentence. Look at A, B, and C opposite to help you. An infection which can be treated successfully